Friends, today we are going to do the second model paper of Kerala PSC exam for assistant dental surgeon. So PSC mock test 2 by E-Dental formula. So we have here 100 questions. So coming on to the first question, TMJ is supplied mainly by first option mesenteric and auriculotemporal nerve, second one superficial temporal nerve, facial nerve and peripheral branch, and posterior auricular nerve. So the correct option is TMJ, temporomandibular joint, is supplied by option A, mesenteric and auriculotemporal nerve. Coming on to the second question, Perseverance muscle is formed by options are palatoglossus, palatopharyngeus, styloglossus, superior constrictor. Perseverance muscle is formed by palatopharyngeus. Option B. Next question. Muscles of mastication develops from which arch? First, second, third or sixth? Muscles of mastication is always developing from the first branchial arch. Option A. Coming on to fourth question. Level 3 neck nodes are mainly in the submental triangle or in the posterior triangle, or whether they are midline from hyoid to that of the suprasternal notch, or around the middle 1/3 of internal jugular vein. So as you can remember, level 3 neck nodes are which area? They are present on the middle 1/3 of internal jugular vein. So option 4 is the right answer. Coming on to fifth question. Internal carotid arteries are derivative of first, third, fourth or sixth pharyngeal arch. Internal carotid artery is a derivative of third pharyngeal arch. Option B is the right answer. Chromatolysis is what? What is chromatolysis? Whether it is disintegration of nucleus or disintegration of the Golgi apparatus, disappearance of the nasal granules or decrease in cell size. Chromatolysis means there is disappearance of nasal granules. So option C is the right answer. Drumstick is found in which of this structure? Neutrophil or lymphocyte or monocyte or platelet? Drumstick is a characteristic feature of neutrophils. Option A. Deficiency of cortisol causes Cushing syndrome, Graves' disease, Addison's disease or acromegaly. So deficiency of cortisol is always associated with Addison. Okay, so option C. It is associated with Addison's disease. What are G proteins? Whether they are membrane receptors or regulators? So just remember, G proteins are regulators. Okay, proteins, G proteins are regulators. So membrane regulators. Option B. 10th question. Vitamin D3 is ergocalciferol? No. Cholecalciferol, 1,25-dihydroxycholecalciferol or 7-dehydrocholesterol. Vitamin D3, it's very easy. Cholecalciferol. Okay. Option B. Vitamin D3 is cholecalciferol. Next question. 11. Reed-Sternberg cells are seen in histopathological examination of which? So just remember, Reed-Sternberg cells are seen in Hodgkin's disease. Option B. Question number 12, tumors involving epiphysis of long bones. Okay, so here clearly it is mentioned epiphysis. Epiphysis of long bones. Osteogenic sarcoma or clastoma or evic sarcoma or chondrosarcoma. So the right answer is clastoma, osteoclastoma. Epiphysis of long bones, we see osteoclastoma. Now what is lupus vulgaris? Tuberculosis of the skin or autoimmune skin disorder or syphilis infection or tuberculous lymphadenitis. Lupus vulgaris is a tuberculosis of the skin. Option A. Question number 14. Affected father is transmitting disease to all of his daughters is an example of. So here it is whether it is an X-linked condition or a autosomal dominant condition or mitochondrial condition. Definitely it is a X-linked condition. Now check whether dominant or recessive. So the question says affected father transmitting disease to all of his daughters. So it's an example of dominant condition. Okay, X-linked dominant condition. Question number 15. Trisomy 22 may result in which of the following? Trisomy 22. 22. Just remember the number 22. 22. Okay, so it is actually cleft palate. Okay, option D. Question number 16. High concentration of bupivacaine is contraindicated due to its what action? Whether bupivacaine is causing cardiotoxicity. So option C is the right answer. Okay, contraindicated due to its cardiotoxicity. Side effect of antihistamines. When you give someone antihistamine, they will be very down. Okay, so drowsiness. Okay, so option C is the right answer. Rituximab is used as what? Rituximab is actually a famous monoclonal antibody. So option B is wrong, option C is wrong, option D is wrong. Correct answer is monoclonal antibody. Question number 19. Which disinfectant causes skin allergic reaction? Hypochlorite, chlorhexidine, alcohol, hexachloroquine. Okay, so which disinfectant causes skin allergy? Chlorhexidine will cause skin allergy. Okay, chlorhexidine. Diabetic patient taking metformin develops deficiency of which vitamin? Most of the times diabetic patients are given metformin as the first line drug. So along with it, doctor will prescribe which vitamin? Vitamin C, A, B2, B12. Last option, B12. Okay, most of the times the doctor prescribes vitamin B12 for diabetic patients along with metformin. Question number 21. Iron absorption is decreased in the presence of all except. Question is except. Okay. Iron absorption is decreased in the presence of phytates. That is true. Iron absorption is decreased in the presence of tannins. It is true. Phosphates also true. Ascorbic acid is not an option. Okay. So it is not reduced in the presence of ascorbic acid. So answer is ascorbic acid. Question number 22. The amino acid required for the synthesis of heme. Okay, for heme synthesis, you require glycine. Option C is the right answer. Glutamine or glutamic acid or glycine or lysine. Option C, glycine is the correct answer. Amino acid required for the synthesis of heme is glycine. The following are derived from cholesterol except. So the question is except. Okay, remember except. The following are derived from the cholesterol except. You get bile acids from cholesterol. Yes, true. Steroid hormones. Yes. Vitamin D is derived from cholesterol. Energy. No, you don't get energy. So option D. Vitamin A toxicity causes what? Question number 24. Vitamin A, if it becomes high, toxic. So just look into the options C and D. C says increased intracranial pressure. D says decreased intracranial pressure. So the option will be either of this. So vitamin A toxicity causes increased intracranial pressure. Question number 25. Which does not take place in mitochondria? TCA cycle or HMP shunt or urea cycle or beta oxidation of fatty acid. So mitochondria definitely causes beta oxidation of fatty acid. That is correct. It causes urea cycle. That is also correct. TCA cycle also takes place in mitochondria, but HMP shunt doesn't take place in mitochondria. Okay, so option B is the right answer. 26. Kaposi sarcoma is associated with HHV8 or HPV or cytomegalovirus or Epstein-Barr virus. Kaposi sarcoma is associated with human herpes virus 8. Option A. Fiber optic endoscope is sterilized by. So most of the times the microscopes are sterilized by glutaraldehyde. So option A is the right answer. Not by autoclave method, not by chemical method, not by hot air oven method. It is by glutaraldehyde method. Which of the following is not used as an antiseptic? Question number 28. Which is not used as an antiseptic? Remember the question. Hypochlorite, alcohol, chlorhexidine, hydrogen peroxide. So the one which is not used as an antiseptic is hydrogen peroxide. Okay, hydrogen peroxide is not used as an antiseptic. Okay, now all are antigen presenting cells except macrophage, dendritic cell, T cell, B cell. Macrophage is an antigen presenting cell, dendritic cell is an antigen presenting cell, B cell is an antigen presenting, T cell is not a antigen presenting cell. Option C. Question number 30. A type of immediately occurring reaction in which antigens will combine with the antibody already attached to the surface of mast cells and basophil is called as which type of hypersensitivity? So it is actually type 1 hypersensitivity reaction, direct attachment of the antigen with the antibody which is already attached to the mast cell and basophil. So type 1 hypersensitivity reaction. Definition of type 1 hypersensitivity reaction. Question number 31. An imaginary occlusal curve that contacts the buccal and the lingual cusp tip of mandibular buccal teeth is called the. So it is mandibular buccal teeth contacting. The buccal and the lingual cusp are contacting. So that imaginary line is called as curve of Wilson. Okay, option D, curve of Wilson. Question number 32. Major fossa in the maxillary molar is distal fossa. It's an easy question. Okay, distal fossa is the major fossa in maxillary molar. Question number 33. Mandibular second premolar occlusal anatomy can be of any type. So variations of the second premolar anatomy, occlusal anatomy. It can be an H shape, it can be a Y shape, it can be a U shape, but definitely not a V shape. So question number 33 answer is option D. 34. Which index correlates the maturational status of a tooth to its developmental stage? Maturational status of a tooth to its developmental stage. It is option A, Demerangen's index. Question number 35. The distinguishing character of a particular tooth in a one group. So in one particular group, one particular tooth is being characterized. So it is type, okay, type trait. Question number 36. Interdependency of osteoblast and osteoclast in bone remodeling is called as lacunae or coupling or reversal lines or canaliculi. So this interdependency, osteoblast and osteoclast are dependent on each other. This particular phenomena is called as coupling. Option B. Question number 37. Which of the following enzymes are involved in bone formation? Definitely alkaline phosphatase is involved in bone formation. So either it can be option A or option C. Coming on to these two options, urease is not involved in bone formation, okay, but phosphorylase is involved along with alkaline phosphatase. So answer is option C. Alkaline phosphatase and phosphorylase are involved in bone formation. Question number 38. Which of the following is not present in saliva? Lysozyme is present in saliva. Phosphate, it is present in saliva. Bicarbonates are present in saliva. Trypsin, no, it is not present in saliva. Question number 39. Elongated retipex are seen in alveolar mucosa? No. Floor of the mouth? No. Attached gingiva? Yes. Okay. Elongated retipex are seen in the attached gingiva area. Okay. Now, question number 40. Hammock ligament is present in which area? Between the temporal and sphenoid bone, between hamelar notch and mandible, in apical area of the tooth? Yes, definitely option C. In the apical area, you see the hammock ligament. Question number 41. The sprue in the wax pattern must be placed at what angulation? We have learned in sprue, we have learned in prosto, sprue in wax pattern must be placed at an acute angle. Okay, so option B. Question number 42. Instrument used to plane buccoproximal and linguoproximal walls in class 2 cavity. Okay, so when you plane the buccoproximal, linguoproximal walls in class 2, you always use a enamel hatchet. Okay, so enamel hatchet. Instrument used to plane the buccoproximal and linguoproximal walls in class 2 cavities, enamel hatchet. Option A. Question number 43. Affected dentine differs from the infected dentine in that it has been invaded by the organism. They both are precisely the same, not invaded by microorganism, not been demineralized. Okay, so affected dentine differs from infected dentine. So affected dentine does not contain microorganism. So option C is the right answer, not invaded by the microorganism. Coming on to question number 44. Smooth finish is obtained by using, just remember, smooth finish by 30. So 30 fluted burr is used to get a smooth finish. Question number 45. In silver modified art technique, okay, SMART technique, silver is added in which form? Silver is added in the diamond form. Remember that. Silver is added in diamond form. Silver diamond fluoride. Okay, option B is the right answer. Question number 46. Carbamide solution uses for bleaching degrades into 3% of hydrogen peroxide. Option C, 3% of hydrogen peroxide. Question number 47. Apicosectomy is contraindicated if there is extensive bone loss. It is contraindicated. That is true. Overfill root canals? No. Lateral perforation of the apical third? No, is not contraindicated. Yeah. So apicosectomy is contraindicated if there is no bone. So extensive bone loss. Option A is the right answer. Question number 48. An avulsed tooth before replantation must be treated with doxycycline. Okay, option A, doxycycline. It is not treated with dexamethasone, ampicillin or ibuprofen. It is definitely treated by a doxycycline. Question number 49. Most useful in differentiating an acute periapical abscess with a periodontal abscess would be, so whether the tooth is vital or not is very important. Okay, in case of periapical abscess or periodontal abscess. So the differentiating factor is pulp vitality test. Question number 50. Technique of root canal preparation known as telescopic technique is a conventional step back procedure. Option C is the right answer. Question number 51. Cyst arising from the cell rest of molasses. Cyst arising from the cell rest of molasses is what? It is option A, dental cyst or dentigerous cyst or radicular cyst or keratocyst. It is radicular cyst, option C. Question number 52. Perliche is caused by increased interdental space. Option B is the right answer. Perliche is caused by increased interdental space. Now question number 53. The primary causative factor for MPDS of the TMJ. Whenever there is an excessive contraction, you get muscular pain dysfunction syndrome, MPDS. So option C, muscular overextension, overcontraction. Option C. Question number 54. Features of trigeminal neuralgia do not include paresthesia, paroxysmal pain, refractory period, presence of trigger zone. Okay, so trigeminal neuralgia, there is a trigger zone. Refractory period is also present. Paroxysmally pain is also present, but paresthesia is not present in case of trigeminal neuralgia. Option A is the right answer. Question number 55. Dayer's disease is associated with pernicious anemia, rickets with involvement of the teeth and bone, vitamin D deficiency, and involvement of the oral epithelium and skin, diffuse tender ulceration on the palate predominantly. So what do you think? The answer is Dayer's disease associated with vitamin A deficiency. So option C is the right answer. Which of the following is used as anti-flux? Borax, boric acid, carbonate, graphite. So you definitely know graphite is a very good anti-flux material. So option D is the right answer. The first tissue to react when orthodontic forces are applied is, when you apply the orthodontic force, the first tissue to react is always a PDL, periodontal ligament. Okay, so option A is the right answer. 58. The best space maintainer for the early loss of upper primary incisor is the pin and tube maintainer, because, so they have already told you the answer. The best space maintainer for a upper primary incisor loss is pin and tube maintainer. Why pin and tube maintainer? Because it is aesthetically acceptable? No, that is not the reason. It does not injure the upper lip? No. It is easy to fabricate? No, definitely not. It allows lateral growth of the bone. That is a right answer. Okay, it allows lateral growth of the bone. Question number 59. Which of the following are examples of fixed active appliance? So the appliance should be a fixed one. So Beck is a choice. It should be active also. So Herbst is not an active appliance. So straight wire is an active appliance. So Beck and straight wire is an option. Okay, option A. Coming on to 60. Jasper jumper is a flexible appliance. It's a fixed appliance. It's a functional appliance. So option C and option A. Just look into the option. Both are fixed functional appliances, but there is one more addition to option A, flexible. Yes, Jasper jumper is also flexible. So option A is more preferably correct. Flexibly fixed function appliance. Question number 61. Distal shoe space maintenance is mainly indicated for what? For, as you all know, it is for guiding the mandibular first molar. So option B is the right answer. Question number 62. Egocentrism and animation is found in the following stage of cognitive development. So the children will show egocentrism and children will show animation. Features of animation after saying cartoon is found in the following stage of cognitive. Before operational stage, that is pre-operational stage, they will show. That means during their 4 to 5 years of age. Okay, 4 to 5 to 6 years of age. Question number 63. Window of infectivity is given by Cofield is from. So window of infectivity in case of HIV, okay, AIDS. It is given by Cofield. So window of infectivity is after you get the infection, from that moment after 1.5 years to almost 3 years. So 1.5 to 3 years, which means 19 to 31 months. Okay, 19 to 31 months. Question number 64. Young formula uses what? Body surface area? No. Weight? No. Chronological age or dental age? That is a confusion. Young formula always uses chronological age of the patient. Okay, so it is option C. 65. Who has restricted the sugar intake in diet up to what percentage? Always sugar intake must be very low. Okay, that is a very applicable answer. 5 to 10%. Okay, so Among the options, the least restricted sugar intake in diet is up to 5 to 10%. Okay. Question number 66. The extraoral radiograph that best demonstrates the subcondylar portion of the mandible is the. So you need to view subcondylar portion, that too from the extraorally. So anterior posterior mandible will show subcondylar region? No. Waters view? No, never. Townes view? Yes. Okay. Townes view will show the subcondylar portion of the mandible. Question number 67. An X-ray picture shows bone expansion with honeycomb or sow bubble appearance, eccentrically ballooned, cortical bone is destroyed, periostally there is a reaction. Okay, so just check the clues. Honeycomb or sow bubble appearance. So aneurysmal bone cyst is an option. Central ossifying is not an option because it is already given cortical bone is destroyed. Okay. And they have given another option, there is periostally reaction also. So that is not related to giant cell tumor. So aneurysmal bone cyst is a better option because it contains honeycomb appearance, that is true. Eccentrically ballooned, then cortical bone is destroyed inside. Periostally there is evidence. Okay, and there is, histologically speaking, when you cut and open, you get bleeding. Okay, blood soaked appearance, soaked sponge appearance. So this is a radiographic feature. So option C is the right answer, aneurysmal bone cyst. Coming on to 68, ALARA principle. Okay, what is ALARA? It comes in OMR, okay, radiology. As low as reasonably achievable is the full form of ALARA. Okay, so option A is the right answer. 69, potassium bromide in developer function as what? In developer solution, potassium bromide act as a restrainer. Okay, it acts as a restrainer. So which is the restrainer in developer solution? Potassium bromide. Okay, just remember option B. 70, recommended grid ratio. What is a grid ratio in radiology? 8:10. Okay, grid ratio is 8:10. Just remember. 71, what is the color coding of bag in hospitals to dispose of human anatomical waste such as body parts? So after you are removing the body parts, so you remove and you dispose in which color bag? You're supposed to put in yellow color bag. Okay, so option A. Question number 72, measure of dispersion in normal distribution from mean is known as. So in statistics, you get a dispersion from mean, that is standard deviation. Option A. Question number 73, which sample is independent of each other? When you randomly pick some samples, they will be independent of each other, isn't it? So option B is the right answer. 74, screening of oral cancer is a primordial prevention or secondary or primary prevention or tertiary? It comes under secondary prevention. Okay, screening of cancer is a secondary prevention. Okay, by cytology method, etc. 75, geographical distribution of frequencies of characteristic in biostatistics is shown by which method? So you have to get the geographical distribution. Okay, so geographical distribution is given by a cartogram. Okay, option A, cartogram. 76, square root of PQ by N indicates what? PQ by N square root definitely gives you proportion. So standard error of proportion. Okay, standard error for proportion. Option C. The father of epidemiology, very easy. Who is it? John Snow. 78. The index used to record the plaque score, low and stillness score. Plaque index, low and stillness. Option B. 79. Dental caries is associated with fluoride level in water below 1. Okay, remember 1. 1 milligram per liter. So, option C. Question number 80. The lactobacillus count test to assess the caries activity was given by Snyder, J. Hadley, Edelstein. So we always get confused between Snyder and Hadley. Okay, lactobacillus count test to assess caries activity was given by Hadley. Okay, option C is the right answer. Question number 81. Factor responsible for pregnancy gingivitis, hormonal imbalance, microorganism associated with the plaque or poor oral hygiene or drugs. We always have a tendency to go for hormonal imbalance here. But remember, they telling you pregnancy gingivitis. So always it is associated with a microorganism. So microorganism associated with the plaque is the right answer. 82. The predominant organism found in smears of anak. Anak, the type of organisms are spirochetes. Okay, acute necrotizing ulcerative gingivitis. Anak is caused by spirochetes. So option C. 83. In an infrabony pocket, the junctional epithelium will lie always below, isn't it? So apical to the crest of alveolar bone. Okay, not apical to the root apices, not coronal to the crest of the alveolar bone, not at the level also. It is apical definitely, but below, apical to the alveolar bone. Crest of alveolar bone is the answer. Infrabony pocket. Question number 84. All are true about osseous craters except osseous craters are not present in the they are 2/3 of all mandibular defects. That is correct. Okay. But in the mandible itself, where they are present, anterior, posterior, that is the second option. Second option says they are present more in the anterior region. No, that is not correct. 85% lingually and facial height is same. That is correct. 1/3 of all defects. That is also correct. Option B, 2 times more common in anterior region is not a correct statement. Okay, so osseous craters are present mostly in the posterior region. So option B is the right answer. Question number 85. Juvenile periodontitis. Juvenile periodontitis is a defect connected to neutrophils. Okay, so whether it is neutrophil chemotactic defect or neutrophil adhesion defect, it is a neutrophil chemotactic defect. Option C is the right answer. Juvenile periodontitis is a neutrophil chemotactic defect. Treatment of solitary Langerhans histiocytoma of mandible. How do you treat it? Okay, using radiotherapy? No. Using curettage? Yes. Okay, so how do you treat solitary Langerhans histiocytoma of mandible? By the best method among the given option is curettage. Okay, treatment is definitely required, not chemotherapy also. Curettage is the best method. Involucrum is newborn. Involucrum, newborn. Okay, NN stands for newborn. So the option will be definitely second. New live bone surrounded by a dead bone will be surrounding them. So involucrum. Question number 88. Sagittal split osteotomy is a procedure done in the mandibular ramus. Okay, so that name of the technique itself is ramus sagittal split osteotomy. So ramus, definitely ramus. Camper line is the line which runs from, option A says, inferior border of the ala of the nose to the superior border of the tragus of the ear. Yes, that is correct. Line runs from lateral wall of the orbit. No, definitely not. Not connected to orbit. Line is drawn from the tip of the nose to soft tissue chin. No. Line is drawn from the tip of the nose to most prominent lip. No. It is definitely from the inferior border of the ala of the nose to the superior border of the tragus of the ear. Option A. Question number 90. LA, which is fast acting, so the local anesthetic which is fast acting and have short duration, but definitely in children. The question is in children. Fast acting, procaine, lignocaine, tetracaine, bupivacaine, which is fast acting. Procaine is fast acting, but short duration also. Short duration is also procaine. Okay, so in children, procaine. 91. The component responsible for allergy in dental casting alloy is, okay, allergy connected to nickel. So nickel is the best option. Not cobalt, not copper, not titanium. Nickel is always having a tendency for allergy in casting alloy. Question number 92. The pure form of gold used in dentistry is known as cohesive gold. Okay, the pure form of gold is cohesive gold. Question number 93. Working time of polyacrylate cement, 3 minutes. Okay, polyacrylate cement working time is 3 minutes. Okay, option C. Question number 94. Dental porcelains are crystalline materials of rubber? No. Plastic? No. Organic substances? No. Dental porcelains are crystalline materials of glass. Option D. Question number 95. Varnish is used under which cement? You give varnish under amalgam? No. ZOE? No. Zinc phosphate cement. Okay, zinc phosphate cement. Option C. The relationship of the denture base that resists the dislodgement of the denture in horizontal direction. So you are giving a denture to a patient and the denture is dislodging in a horizontal direction and you say the denture has got poor stability. Okay, not a retention. Vertically retention. Okay, horizontally you have to tell about the stability. 97. Which muscle has dual function related to complete denture? Masseter. Masseter has got dual function. Okay, not temporalis, not buccinator, not alternator. Related to complete denture. Okay, masseter. Question number 98. Most reliable method of recording centricillation. Most reliable method is by tracing method. So graphic tracing method with excessive movement. Okay, so option A. 99. After wearing complete denture, the trouble in pronouncing the letter T is caused by. So just check. When you pronounce letter T, the tongue will go and touch the incisors, maxillary incisor, isn't it? So T, T. Okay, so incorrect positioning of maxillary incisor, if you do, you cannot pronounce the letter T. So option C is the right answer. 100. Boucher's method of relining is a open mouth technique, chair side method, functional relining method, or closed mouth relining technique. Boucher's method is a open method. You do it open method. So it is option A is the right answer. Okay, so friends, we have completed the PSC model paper 2. Subscribe to the channel and please comment below the video so that if there is any doubt, I can clear directly. So more such videos will be coming up. So please do subscribe and follow. Thank you.